Welcome to This Week in South Carolina. I'm Gavin Jackson. Businesses have reopened and schools are about to go back into session in South Carolina. And COVID-19 numbers are falling. We talk with DHEC physician Dr. Brannon Traxler and MUSC Health CEO Dr. Cawley about the pandemic. And we also have the latest from this week. Case numbers and death rates continue to decrease statewide this week, a trend that has health officials optimistic. However, the infection rate remains high and the number of people getting tested has been decreasing. This comes as Senate lawmakers want to see DHEC increase its monthly testing goal, which comes as students in some districts and on college campuses return. Governor Henry McMaster told reporters this week that there is no tension between him and Dr. Linda Bell after a story in the state newspaper in which they obtained an email from the state epidemiologist to coworkers, in which she called the governor's office somewhat manipulative during meetings.
There are no tensions among any of us on the team, but there's a lot of discussion that goes into making these decisions. And of course, I'm the one that has to make the decision. You have one governor, so he or she is the one that has to make the decisions. And I think that all things considered, the path that we are charting, have charted, and are charting now in South Carolina is the right one for South Carolina.
A recent Quinnipiac poll found South Carolinians were evenly split on the governor's handling of the pandemic. Also this week, the Joint Bond Review Committee heard the latest on mobile hotspots being deployed to some 97,000 homes with school children across the state, which has led Senate Finance Committee Chairman Hugh Leatherman to say he wants to see money in upcoming budget negotiations for more internet improvements.
And we need to get our heads together and make those decisions. And if the state needs to put up some money to be used as match money from the private sector, my position is so be it.
And Congressman Jim Clyburn praised former Vice President Joe Biden for his pick of Senator Kamala Harris as his running mate. Clyburn spoke with Biden multiple times leading up to the announcement Tuesday, but said he didn't tell the presumptive Democratic nominee who to pick.
Well, I've said before, there are a lot of great women to choose from. Asians, Latinx, African American, white, a lot to choose from. And I said to him, I'm glad it was not me having to make the choice. I am very pleased with the choice. The fact of the matter is, I would have been pleased with any one of the ones he had under consideration.
Now joining me is DHEC physician Dr. Brannon Traxler. Dr. Traxler, welcome back to the show.
Thank you. Thank you for having me again.
So, Dr. Traxler, it's been a while since we talked. We'll go through a lot of data that you guys have, but some new data that just came out from you all at DHEC is fascinating. It looks at the mask ordinances, the mandates that have been placed at local jurisdictions, and just, some 2 million South Carolinians are under these mandates right now to wear a mask in public or in certain places. Kind of tell us what the data shows and what, whether it's good or bad at this point.
Certainly. So our data analytics team looked at the case trends, the incidents in the several weeks after most of these mask mandates went into place compared to prior, and found that the locations that had a mask mandate in place had a 43 or 44% basically lower incidence rate. So they were seeing fewer new cases developing compared to the locations that don't have a mask mandate in place.
Mm-hmm. Yeah, jurisdictions without one and without requirements, what they said, overall increase of about 30.4%. So big decreases for places that do have one and increases for places that don't. So what's the trade-off here? What do we have to do?
Right. So the locations that did have the mask mandates in place, they showed a decrease in those cases of 15% versus, as you said, an increase in cases in the ones without a mandate of right at 30%. And so it shows that the masks are working. It shows that the more people that wear masks, the more it's doing to slow the spread of the disease in the community.
What are you hoping DHEC will accomplish by providing this data? Do you think that might spur some other municipalities or counties to act? We've seen the governor's not big on doing a statewide mask mandate, but what do you think that this might help spur?
Certainly. Well, so I'd say twofold. I would say certainly we encourage and very much support all of the local municipalities and counties that do mask mandates, that either have done them or are considering doing them. But we also, it's information for every member of the general public that shows that masks in South Carolina make a good difference. And so it doesn't require a mandate for everybody to choose to wear a mask. That's something we can all choose to do even without a legal requirement. And so I really encourage everyone to do it.
Mm-hmm. And looking back in July, it seemed to be July was our worst month from what it looks like. Record high case numbers per week, record high death rates so far. Kind of walk us through where we were since we've kind of last talked. We took July off, but where we were in July, and then where you're seeing us going right now when we look at these cases and other data that you guys are analyzing.
Certainly. So we did see our highest numbers in July, but we have for the last 2 to 3 weeks seen some positive trends. And every week that the case counts continue to go down, and then of course with a little bit of a lag, the death counts as well, I get more encouraged. I'm still cautiously optimistic, but we're definitely on the right direction. So I hope to see these continuing to decrease. This is just proof that what people are doing is working, and so they need to stay the course, not slack off because we're seeing improvements. That's the time to actually double down on your efforts.
Mm-hmm. And what's that surge looking like? I was over in Horry County. I was at Tidelands, Waccamaw, and they have just seen just weeks on end since late June until recently, just day in, day out, overcapacity hospital beds, ICUs. Staff being stretched thin. What are you hearing statewide when we come to what hospitals are facing right now still?
Certainly. So we have heard and have worked with some hospitals that have had some higher than usual capacity, percentages, and certainly have been challenged in those regards some ways. But it's a multi-pronged approach. There's many agencies and organizations working with them to get them the help they need. But overall, we are still seeing that there are hospital beds in South Carolina. We're still seeing that we're not at full capacity statewide, but we are probably trending a little bit higher than we maybe normally would. Again, this is just all the more reason for people to do what they can to decrease the spread of the disease, especially as we approach flu season coming up here in the next couple of months, when we know hospitalizations increase from flu. We'll need those beds. Mm-hmm.
So just hoping that positive data of hospitalizations, ventilators, and other associated data continues to decrease, because then that does affect how hospitals respond to this as well.
Absolutely, absolutely.
But Dr. Traxler, when we look about going back to school, a lot of people kind of pinpointed Memorial Day weekend, the start of summer, to really, attributed to all those case rises we saw in late June, July, continued through. Is there a worry? Do you have one? Do leaders at DHEC have a concern that there might be some sort of increase as a result of some students going back to school? Not all of them are, obviously. There's hybrid models, there's in-person schooling. What do you think might happen as a result of students going back, and what are you guys planning for at this point?
So we are absolutely working with all of the schools and school districts, no matter how many days a week they're there in person, to provide information, guidance that they need. We are listening very much to what they're telling us in terms of further information or guidance or protocols that they're requesting. We continue to refine and update and develop new information for them, because we really are giving them guidance to get students back in the safest way possible. And from talking to some of these folks, I can tell you that they really are doing everything they can to do it safely, and we're providing all the guidance. So again, if people everywhere, not just at schools, but out in the community, continue to do the right things so that there's not as much disease being passed around, then there will be less chance of it being entered into a school.
So I know it varies by district, but what happens overall if a school does tend to have an outbreak? And we've seen in some schools around the country that have already gone back, they've seen pockets and they shut down. What should schools be doing? What should parents be aware of if they have a student going back and there is an outbreak?
Certainly. So we will be working with schools, whether it's one case or multiple cases that they have in people associated with their schools. And so, we will be providing guidance then too, if there are, again, whether it's one case or multiple cases, to parents. We'll be providing information, as if their child was potentially exposed, working with the schools to provide that information to parents so that they know what to do. But the main thing just in the COVID environment for children in general, in school and just outside of school, is for parents to keep a keen eye on them. If they seem to not be feeling well, even the least bit, keep them home from school, get them tested, make sure it's not COVID-19. And if it is, keep them home the full time for isolation. If you are informed either through the school or outside of school that your child has been a close contact of somebody who tested positive, keep them at home for that quarantine period and really follow those directions that DHEC, sometimes if it's at school, in conjunction with the school, provides to you.
Mm-hmm. And then again, this all gets compounded, like you said, with flu season coming up too. So really quickly, Dr. Traxler, just tell me what your big concern is now going forward, now that we've been into this pandemic for several months now. What's your concern at this point as we head into the fall?
Certainly, and so I think it's some of the unknown. I don't have a crystal ball to know what's going to happen in the fall, whether we're going to see another wave, as some people are concerned that could, which is a possibility with this virus. We just don't know because it's new. We've never had a fall season with it before. But that's something that we're preparing for in the event it does happen, which, and again, that would coincide with flu season, which would compound things.
Gotcha. Well, Dr. Brannon Traxler with DHEC, thank you very much for joining us.
Thank you.
Joining me now is Dr. Patrick Cawley. He's the CEO of MUSC Health, and he's the Vice President of Health Affairs at the Medical University of South Carolina. Dr. Cawley, thanks for joining us.
Oh, thank you for having me.
So, Dr. Cawley, I want to start off by getting an idea about what your hospitals and your system are facing right now. Kind of let us know, we've seen hospitalization rates lowering, we've seen case numbers going down. What are you seeing in the hospitals right now?
Well, in the hospitals, in one of our hospitals, our main hospital in Charleston, has been seeing decreasing numbers over the last several weeks. We had peaked about 2 or 3 weeks ago, about 120 patients in the hospital. And today we're seeing almost 50, high 40s, and we've been sitting at the high 40s for about a week. So had a peak, but we're down.
Mm-hmm. And when it comes to that peak, what was it like in July? Obviously, it was a very busy time in July, and now we're in August, but what has it been like for your staff? Have you been seeing shortages? Has the emergency department been backed up? What's it like when it's on the front lines right there?
Well, the peak was a tough time. I mean, it was, you're full and you're not sure how long the peak is going to last. We look at it now, we look and say, oh, well, we got through that. But at the time, we didn't know. We didn't know if the peak was going to stay on for 3 months. Mm-hmm. So there was really a lot of scrambling to potentially find and get more beds, get more nurses, get more doctors, just be prepared. So a little bit of frenzied planning, as well as just taking care of patients and really trying to support the team, because the team is under tremendous stress as well.
Mm-hmm. So it's calmed down a little bit, it's stabilized. What do you look for to ensure that this is going to continue? Are you guys constantly looking at metrics such as case numbers or the incidence rate? What are you looking at to make sure that things kind of remain the same, and what are you hoping is done to help make them stay the same?
Well, 2 things we're doing. We look at our own numbers every day. So we look at the number of patients in an ICU versus not in an ICU, and then the patients that are in the ICU, what kind of care are they needing? Do they need to be on a ventilator? Do they need to be on certain other kinds of therapies? So we look at all those things. It gives us a picture of what's happening in our own hospital. Then we look outside. And in Charleston, we keep an eye on the Tri-County numbers. In our other hospitals, we do the same thing. And it gives us a sense of what's happening in the community. So in Charleston, I know for the last several weeks, the growth rate of new cases has been going down. So good sign. In the meantime, though, our total numbers of patients in the hospital have come down, but how sick they are as individuals has remained pretty high, and which is not unusual. COVID, sometimes it can take 2 or 3 weeks for a patient to get fully through an episode. So, we're still at that point where we still have very, very sick patients in the hospital.
Mm-hmm. And are patient outcomes improving with treatment, with things you've learned? What's it like right now in terms of, outcomes for some of these very sick patients?
Well, compared to where we were as a nation in the spring, outcomes are definitely better. Mortality rates are much better. But in terms of being in the hospital, the length of time someone's in a hospital, we call that a length of stay, that's remained pretty long. Mm-hmm. And although we do think there are better treatments out there, remdesivir is one of them. We've been able to use. We've been using a lot of convalescent serum as well. We think that works. And then just what we call just basic, good, critical care and monitoring of the patient. So overall, I would say things are better than where we were as a nation several months ago.
I want to jump to testing right now. We've seen that the testing numbers have decreased, but the percent positive is still over 10%. That number that you guys want to see things fall under. What do you think is attributed to this? The testing fall off. Do you think people are going to testing sites and maybe they're too busy, or they don't want to wait 7 days, sometimes 2 weeks to get test results back? What do you think is causing that drop off in testing right now? Sure,
I think there's a variety of things. So I do think when the incidence of disease or cases starts going down and people are not having as much symptoms in the community, they're not going to get as many tests. So there's a little bit of that. I would agree, there is frustration about tests and particularly test turnaround time. A lot of people can get testing, but sometimes you may not get the result for an entire week. So I think a lot of people, particularly if it's mild, they're just saying, I'm just going to quarantine for 14 days and I'll be fine after that. So I think all those things kind of mix together.
So how do you see addressing those challenges? What are you proposing? What are you seeing at the state level with other officials in terms of cutting back on that turnaround time?
Yeah, we've been aggressively pursuing a lot of different things, and we've been involved in a lot of testing here at MUSC since March. So really between MUSC and the state DHEC Public Health Lab, that accounts for almost half of the testing across the entire state. So we've been heavily into testing. I think there's two things. Number one, we need to increase capacity. So helping hospitals make sure they have the right machines, make sure they can adapt to new types of tests that are coming forward, just trying to stay ahead, plan 2-3 months out. I think that's where we're at. A month ago, there's still a little bit of scramble from a lot of different institutions, but I think we're starting to get ahead of it, but we need to keep working on capacity. The second thing is test turnaround time. Mm-hmm. Now, you would think if you increase capacity, you're naturally going to get a better test turnaround time, but unfortunately, in many circumstances, there are manual processes in order to get the result back to the patient. And we've had a whole room of people just calling patients and sending results back. And when it's that manual, it is going to take time. So both of those things we're working on. In terms of the second one, I just testified in front of the Senate in the last couple of weeks. And I think one of the things we need to think about as a state is what we call a health information exchange, where we pass the data electronically and maybe even set up a patient portal. Mm-hmm. So that as soon as the result is known, it comes out of the machine, it could be sent immediately to the patient. Mm-hmm. So we're working on that. That's got a lot of complexities to it, but we're working with a variety of different entities across South Carolina and the legislature to think about a health information exchange.
You're talking about the Senate committee about reopening SC. They said the other day that they want to see testing about 10% a month, 10% of the state's population a month. Do you think that's feasible, especially when we look at our current numbers, which are more than half of that in some cases? How do we achieve 10% a month, in your opinion?
Well, I think testing is changing almost every week. And I emphasized when I was testifying yesterday that the problems of a month ago are not the same problems we're having. So we're having different issues today. I think we're starting to get our arms around it, and I do think better capacity is on the horizon. I do think better test turnaround time, if we do a couple of things, is on the horizon, and we'll get there. Mm-hmm. What happened in the last month was we didn't have the best capacity, we didn't have the best test turnaround time, and then we put on top of that a high prevalence of disease. So put those three things together, man, we really stress the testing system. Mm-hmm. So, I think every week brings better things, and I think we will get another wave. It'll probably come sometime in the later fall, and I think we'll be much more ready for that.
And when we talk about that wave, do you feel that's going to be associated with schools, or do you feel like it's going to be associated with the onset of the flu season, or what are your thoughts on how that second wave might start?
Well, I think it'll be a combination of things. I think what we're seeing really across the nation is, at the moment, we're starting to see the Midwest start to rise. And, I think people tire of all the social distancing and different things, and they start to relax. and then disease pops up, right? So, it's not necessarily going to be schools opening up, but if we're not adherent to the social distancing, the hand hygiene, the masking, it will definitely flare up. So I think it's going to be a combination of things, and kind of what we see sometimes in healthcare. We just see people be real compliant, and then when it doesn't affect them personally, they relax. Then you got to increase compliance again. So I think this is what we're going to be in for, a series of waves.
Dr. Cawley, do you think it's going to be safe for some of these students to be going back to school, whether they're in grade school or college campuses? Some are going all virtual, some are doing a hybrid. What are your thoughts on students going back to school this fall?
Well, I think you got to look at some schools, particularly in Europe, that have gone back and held the total disease numbers back. So I think it can be done, but we have to adhere to social distancing, wearing a mask when you can't socially distance, using proper hand hygiene. A lot of times we forget about the hand hygiene. And then the fourth thing is vulnerable people need to be treated a little differently. If you're vulnerable, if you have a condition which places you at high risk, maybe you need to stay online. So, but need to work through those four things. And I think if we do them well, I think it would be safe for the children to go back to school.
And when we're talking about, using protections, we're talking about masks. Obviously, there's going to be a requirement to wear masks in schools, on certain campuses. Do you think there should be a statewide mask mandate, especially when we saw some data from DHEC just showing how effective these local ordinances when it comes to wearing a mask in public have been?
Well, to me, it comes down to really the local area. We just need to all push on this. Passing a single law statewide is not going to solve this problem. Everybody at the local level needs to be engaged in this and constantly talking, enforcing, working toward those four things that keep the disease prevalence down. So, I'm not a big fan of big sweeping measures because I think people then tend to push off their role. And I think in this pandemic, each and every one of us have a personal and local role that we need to work on.
And when we look at, going from schools to, the playing field, there's been a lot of talk about college football this year. Some schools will be playing, some high schools will be playing. Do you think it's safe for students to be playing these sports when we still don't know all the ramifications and effects of COVID-19, especially when you look at, the muscle heart inflammation possibility, when we see some athletes suffering from that, how it could affect them long term? Do you feel like it's safe to be playing sports when we still don't know so much about this novel coronavirus?
Well, I think that the key to playing sports is testing. And any sports team or anybody who's on a sports team, what I'd be looking at, does the team have access to good testing? Testing ahead of a game or interaction, and particularly if you have symptoms, to get quick testing thereafter. So I think that is the key. I think there have been some anecdotal reports of things like you just mentioned, the heart effects, but those are very rare. And I think that if you do the right things, I think you can do it in a safe environment. I'll take the hospitals as an example. So the hospitals as an example have been adhering to those four things I mentioned earlier. The hand hygiene, the social distancing, the masking, and the protecting the vulnerable. We've been doing that since March. Just about every hospital across South Carolina has been doing that. And our disease prevalence in the hospital is extremely low, right? We also make sure we have quick access to testing, which we layer on top of it, and we make sure that everybody's safe. So I think it can be done, and you can keep the disease prevalence down.
Gotcha. And with just about a minute left, Dr. Cawley, can you tell us a little bit about the challenges MUSC is facing right now going forward? Obviously, the legislature is going to be coming back in September to deal with the spending bill. There's some CARES Act money left over. What does MUSC need to continue its testing mission and to continue fighting the pandemic?
Well, as I testified in front of the Senate yesterday, the main thing is continued support. So we were giving some dollars, almost $25 million, back in May. We've been rapidly going through that very effectively, getting at-risk community testing done. For us, that's going to run out in about 4 to 6 weeks. So if we want to keep doing the testing or want MUSC to do the testing, having additional dollars to keep on going is going to be the key. I think for how we treat patients, I think we're feeling pretty good on on what we need in terms of PPE and staff and all those things. So we feel pretty good about our own personal situation and being able to treat patients.
And just with 30 seconds, what's your big concern? What are you looking for over the next several months as we go into the fall right now?
Well, my biggest worry is a wave that comes that's bigger than the one we had 2-3 weeks ago, right? That one stressed us. It stressed the entire system, health system around us. And if a wave comes in bigger, it's going to be a problem. So I'm hoping that doesn't occur, and I'm hoping that we all do the right thing so it doesn't happen.
Thank you very much for joining us, sir.
Great. Thanks for having me.
To keep you updated throughout the week, check out the South Carolina Lead podcast. We're dropping regular episodes that you can find on any podcast app or southcarolinapublicradio.org. For South Carolina ETV, I'm Gavin Jackson. Be well, South Carolina.